Here are 3 things you should never accept when approaching your healthcare provider about your perimenopause, menopause, or postmenopause. Number 1, your healthcare provider should not tell you that this is just that time of your life and this is your new normal and you need to get over it. Yes, menopause is a natural stage, but it does not mean that you have to put up with symptoms that are causing you misery and have no help. Number 2, it is unacceptable for your healthcare provider to tell you that they don't prescribe hormone therapy. If they are marketing themselves as a women's healthcare provider, hormone therapy is a normal part of treatment. It is up to you and what you want to try for your symptoms, and it is up to them to discuss whether or not they think it is a good idea based on your medical history. Categorically dismissing the option is unacceptable. You deserve the conversation. Number 3, do not allow your provider to impose unnecessary time restrictions. For example, I'll only give you this for a year or 2. This is an ongoing conversation, and as long as your symptoms persist, you deserve treatment.